Greetings, Dr. Mark Winton here from the University of Central Florida Department of Criminal Justice, and in this video we'll take a look at Chapter 7, Drugs and Correctional Interventions. One of the features of this chapter is the focus on how to manage those that have violated drug laws. And so, of course, the goal is to increase public safety. Really, we want to see reduced recidivism. That we hope that when people who spend any time in the correctional system leave, that they will be able to lead a crime-free life, basically. Of course, that doesn't always happen, but it also does happen, and we want to know what are some of the factors that lead to that. And also, the chapter focuses not only on what occurs in jails and in prisons, but also community-based corrections. For example, supervised individuals on probation or parole. So basically, authors point out that there's 4 goals or philosophies of corrections: retribution, incapacitation, deterrence, and rehabilitation. Retribution basically is the idea of punishment for the purpose of justice. Incapacitation basically is putting someone in jail or prison to prevent crime, with the idea that if they're incapacitated, they're not going to be able to commit crimes outside of that institution. Deterrence is basically using the threat of getting caught and or punished to discourage people from engaging in criminal activity. And rehabilitation focuses on basically changing behaviors and thought processes and interactional aspects that lead to criminal behavior, changing all that to decrease the risk of recidivism. So according to your authors, the ultimate goal in the correctional institution is to reduce recidivism, or basically repeating criminal behavior, getting arrested again. One of the major components of effective intervention is the R&R model, the risk, need, and responsivity principle. The risk principle focuses on the who, basically looking at the risk potential of an individual, and that those who are at higher risk need more treatment and more supervision. And in order to determine who's at higher risk, there are a variety of risk assessment tools that can be used. The need principle focuses on the what, the dynamic risk factors, meaning changing risk factors, the criminogenic needs, and some of these include, for example, attitudes toward crime, hanging out with other of those involved in criminal activities, criminal personality traits, substance abusing behavior, being unemployed or having educational deficits, having unstructured leisure time, and having a weak family support system. Now, the responsivity principle basically focuses on looking at the idea that we should be using interventions that have been shown to work for that particular individual or that group, and we need to also take a close look at barriers to success and offer assistance there. So basically, using a research-based behavioral or social learning approach, according to your authors, basically want to know, well, what would be appropriate to use here to get the response that we really want. And then, of course, there's some leeway for those that intervene to make some decisions and choices along with clients in terms of coming up with treatment plans. Applying the R&R model, for example, some examples are provided, and you can find a lot of risk assessment tools using the R&R ideas online. And then, of course, we want to look at, well, the whole idea, what is effective treatment? And we know that in the correctional setting, a large proportion of inmates come in there with a substance abuse disorder. And some of that's related to their crime. It could be a substance-related, a drug-related crime, of course, but also it could be other crimes that were related and influenced by drug use. Only a small proportion of prisoners receive formal drug treatment according to your authors when they are in the correctional setting. And of course, we have to do comprehensive intervention to get the most probability of reducing recidivism. So also there's some information in there about substance abuse treatment in jail versus prisons, and some of the challenges that occur there. Also some discussion of therapeutic communities, which are basically structured residential groups in treatment that really form a supportive group in that sense. There's also a greater discussion on the components of the therapeutic community, and you can read about that, for example, separate residential units in the prison and structured interventions. Basically a lot of it's going to be related to reducing those risks in the R&R model. Okay, there's other substance abuse treatment interventions as well. Groups are frequently used for a variety of reasons. One, looking at social support and cohesiveness of and helping people try to motivate each other to lead a drug-free life. And also, they're cheaper, a lot cheaper to run groups than to do individual interventions or individual psychotherapy. And of course, there are many benefits for having treatment programs in prisons, primarily reducing the risk of drug use and also criminal activity, and also focusing on increasing employability. And as we know, a vast majority of inmates will be released from prison, and there's a risk of recidivism that has been problematic. And so, of course, that's why we want to look at support systems beyond just substance abuse treatment, but also job placement and training, having the ability to get housing and continued treatment and mentoring and other supportive factors that reduce the risks of recidivism. There's also some discussion on different sanctions, deterrence-based intermediate sanctions, for example, focusing on things like fines and drug testing, electric monitoring, house arrest, and so forth. And then rehabilitation-based sanctions, where you're talking more about mental health and substance abuse treatment. There's a discussion also about restorative justice and community residential centers as other interventions, and so you can read about those. And when you start looking at the research, we do know that programs that follow the R&R models have been shown to be successful. And of course, we need to carefully look at different studies to see what's being measured, the population that is, the focus, and what assessment tools are used. And of course, whenever you talk about recidivism, you want to look at how far out that is measured and how it's measured. There's a discussion of drug courts, which are specialized treatment courts that will help usually nonviolent offenders who happen to have substance abuse problems. And so it's often supervised drug treatment and monitoring. So it's an alternative to the traditional sentencing. And of course, the goal is, like in all other treatment programs, to reduce drug use and also reduce recidivism. And due to the popularity of adult drug courts, we've also seen the development and implementation of juvenile drug courts. And some of the characteristics would be having an early identification and placement into these programs in a non-adversarial approach. Also, being able to be monitored, having the court system involved, and having a team approach. That seems to be helpful. And then upon successful graduation, the charges can be dropped. And there's a National Association of Drug Court Professionals that have standards and provide information on the effectiveness. And many people that work in criminal justice are very supportive of drug courts. It's, of course, been difficult sometimes to study drug courts and to compare across different courts, because we may not have the exact implementation of programs, and there's variations there. So we really need to account for that variations. And of course, we see other specialized courts as well that seem to have taken notice of the success of drug courts and followed suit. Also, with community supervision of drug offenders, you have things like probation and parole. Probation is, according to your authors, a direct sentence to community supervision, and parole, according to your authors, involves early release from prison. And so you can read more about that. I can tell you one thing: when you're working in the system, one of the big problems is relapse, and we always have to address that, figure out how to deal with that situation. In my own work, years ago when I was working as a counselor and working in a facility, we did a lot of substance abuse counseling with juveniles, and it was often integrated with working with others in the community, with family therapy programs, with a focus not only on the substance abuse issues, but also with any other co-occurring mental disorders, which was quite common, whether it be anxiety disorder, depression, conduct disorder, whatever the case might be. What you're going to find in the reality of things is that you're often going to have comorbidity or multiple disorders occurring, a substance abuse disorder and one or more other mental disorders. And so that's important to recognize as well. I think I mentioned before, I was doing evaluations, mental health evaluations at this facility, and sometimes people would come in and I'd be doing the evaluation. A lot of what I would do is to figure out what's going on and then make recommendations for treatment plan. There are some people that came in there and I recommend that they would go into inpatient, drug treatment center for 20 or 30 days, and then come back to outpatient therapy on a voluntary basis in those cases. So I thought it would be more beneficial for them to get treatment, for the substance abuse problem first, and then we'll work on some of the other problems. I'll tell you one case real quick. This man comes in, do the evaluation. He's addicted to cocaine. Uses a lot of cocaine, and that was identified as the primary problem. I sent him to a treatment center and told him to come back, and came back about a month later, and he had stopped using drugs, and it was apparent that he was clinically depressed. So we got him into to see one of the therapists there who worked with depression, and so I mean that's pretty common, and you're going to see that a lot, and that's important to recognize. I don't want you to think that you have this or that or that. It's a multi-disciplinary approach where you have to evaluate the whole environment and system as well. And this wraps up this video. Thank you.